Alvarez. I'm with Interactive Health Solutions, and I'm here to talk today about how do you be a smart patient and a smart consumer. The evolution of this more or less became evident during open enrollment meetings, etc., where with the healthcare state that we're in today right now, it's fairly confusing. And not only that, there's a lot of questions regarding how do we come to where we're at today in terms of our healthcare. Not only in terms of the cost, the history of it, but how do we go about being better healthcare consumers? So that's what I'm going to talk to you about today. With the environment that we're in right now, obviously we care about the health and well-being of not only ourselves but also of our families. But one thing that's concerning right now is the cost of healthcare. So it's unfortunate that we're making decisions about our health, but we're also making decisions about the cost of healthcare. So with those two in mind, how do we go about making the right decisions about our health? Before we go there, let's go over some healthcare cost facts. And it's pretty startling when you look at how much we spend on healthcare annually. In 2007, we spent over $2.3 trillion on healthcare. That's amazing because that's over 4.3 times the amount spent on defense. Imagine if we didn't have to spend that much on healthcare, we spent that much on our military, or maybe some other social programs. But as a percentage of gross domestic product, that's 16%. As a percentage of what we produce in our country. So a big chunk of our economy is based on healthcare. And we've been seeing that over the past 5, 10, 15 years, where we're seeing shifts in employment. Maybe, for the loan officers here, maybe you're seeing that in your loan applications. Maybe you're seeing more clinics pop up, more healthcare organizations pop up. We're seeing that more in M&A. We're seeing that in terms of career shifts. When individuals were laid off from the autos, from James and Chrysler, they didn't go right back to manufacturing. They sought jobs in healthcare. So the good thing, obviously, is we're creating domestic labor in the healthcare industry, but that's a result of how much we spend. We're following dollars, we're spending a lot on healthcare. And as a country, however, there's still a lot more that could possibly be spent on healthcare because there's about 47 million uninsured. So that's a lot of individuals. So economically wise, it hurts us to have uninsured because they're obviously accessing healthcare and someone's got to pay for that. Those that are uninsured are more or less subsidizing the cost of the uninsured. But at the same time, it's an opportunity for potential more jobs because now you got to fulfill their healthcare needs as well. But as a dollar amount per capita in this country, we outspend any other country in the world. In fact, we spent in 2005 almost $6,600 per individual on healthcare alone. That's almost double what is spent in Britain. So why is that? Why do we spend more in this country on healthcare than other countries? And it's not going down. We're going to be spending a lot more. I'll go over that with you. So let's look at employer versus employee tax. Did you ever wonder why in this country employers pay for healthcare, not any other country in the world? In the United States, that's our model. Employers pay for healthcare, at least 40% of the healthcare costs. So they're about 55, 60% of the public funding. But the employers have a significant burden on their P&L for healthcare costs. And if you look at the annual average premium for employers, for a family, it's about $12,000 a year. Those are the costs that employers pay. For a single individual, it's $4,400. Now, you look at big corporations that have to shoulder this burden. Some are actually pay for retiree health care, like your autos. But they're spending more on health care than they are on the raw materials, more for health care than they are for steel. The Tribune company spends more on health care than it does for paper. And as that trend continues, it's going to be very, very difficult in our global economy for employers to be competitive when a significant chunk of their P&L is coming out. And I think we all see that pain because now we've seen shifts in the amount of how much we're paying as individuals for healthcare as well. Since 2000, so going back 8 years, we're now paying $1,400 more in premiums per year than we did back in 2000. And that's pretty evident in the shifts of how much we're paying as a percent of our payroll, and how much we're paying also out of our deductibles. I think fortunately, on average, for First Banking Center employees, you guys haven't seen that much of an increase in premiums or deductibles relative to what other small businesses, medium businesses, and large employers are actually going through. Insurance costs going up every year. The average employee contribution for healthcare increased 143% since 2000. So the message here is not only are employers paying a lot for healthcare, we as individuals are not paying more for healthcare. Is that going to go away? No. So So let's take a little history lesson here. You guys see this okay? I mean, it's some fine print. But I'll definitely talk about it. Let's go back. Let's go back only literally almost maybe about 80, 90 years. And let's take a look at how did we come to where we're at today? Why are we a country where employers pay for health care? Why are health care costs so expensive? You really have to go back prior to 1920 to look at hospitals, how hospitals started. Hospitals really were created for individuals to go to not seek treatment, but to seek a place to die. And that's how hospitals were started. And a lot of them were started by Catholic churches, Christian churches. So that's why, you know, why are hospitals named after some saint? They actually started through Catholic churches. And then nuns would take care of those and help them in their last years. But then in the 1920s, something also evolved where Blue Cross and Blue Shield was started. Actually, Blue Cross started first. So Blue Cross stands for, more or less, hospital protection. Blue Shield stands for primary care treatment, physicians, etc. So the Blue Cross organization out of California decided to offer an insurance type of a plan for those who needed chronic or catastrophic care. They saw that these hospitals were experts in somewhat prolonging life during some critical illnesses. So they thought, well, why don't we provide an insurance plan for those that need catastrophic? And that's how Blue Cross was started. The other thing that started in the 1920s is the automobile was created. And GM started to hire a lot of employees. Well, MetLife started, and they started out by this idea of providing insurance. And the insurance idea started more or less along the lines of workers' comp. How do we help employees get better if they're sick on the line and provide those kind of benefits? And now we're seeing benefits started to be offered by a large employer. In terms of healthcare as well, what's interesting is that the first American president was actually born in a hospital in 1924. Now, if you think about that, that was only, what, 80-something years ago that someone was actually born in a hospital. Prior to that, everyone was born out of their house, born through a midwife. So who was that first American president? Kennedy, no, he was born in his house. Truman born in his house. A little later, Nixon. Someone a little later, Nixon was born in his house. Carter. Yeah, that's it. Jimmy Carter is actually the first and only president born in a hospital. Clinton was born out of his house. Bush was born out of his house. Well, you know, I got a question. You don't have to answer this if you don't want to. Who here wasn't born in a hospital? Anybody here not born in a hospital? We're all too young. So, if you think about that,
I want to file a complaint.
no one wants to answer that, right? Someone's born out of their house. Something also happened in the 1920s, which we all know. With the Great Depression, obviously the stock market crashed, and pushed Hoover out, and Franklin Delano Roosevelt was elected on his great deal message. I'm sorry, on his New Deal message. So his New Deal was a pact between government and the people. And his whole position was, well, how do we prevent, obviously, these type of stock market economic woes to affect our social welfare? So his New Deal was between government and people. Now that was the start of big government. So now government started to grow to take a bigger share of responsibility of our welfare. So social programs were started, old age benefits were started. So that was the advent of when the Social Security Act was passed, more or less to protect our welfare in terms of our financial welfare. And that opened the door for health welfare down the road. So the 1930s, the Depression continued throughout the 30s. It was actually a long Depression. It started obviously in the late 20s, but it actually continued all the way up until 1941. What happened in 1941 in December is that we were invaded in Pearl Harbor. We got pulled right into the war. We were not even thinking about entering the war, so we did not have any type of resources set up to manufacture guns and bullets, etc. So all of a sudden, suddenly, our workforce was required to jump in, or our Americans were required to jump into the workforce and make